Health insurance, a necessity for a better, financially secure future. We live in an unpredictable world these days. Thus, there are many legitimate reasons to prepare yourself for those unannounced curveballs. It is often said that diseases do not knock and come. Health risks are not limited to the elderly. Even young individuals can experience illnesses or accidents. Many of us have witnessed the financial burden that medical expenses can impose on families. The high cost of treatment can impact various aspects of our lives, such as purchasing a home, providing for our children's education, loan repayments, and even our own retirement plans. The rising healthcare expenses make it challenging to achieve financial stability and security. Arranging funds for medical emergencies can be difficult, and a single health crisis can have long-term consequences for our financial well-being. It is crucial to prioritize our health and plan for unforeseen medical expenses to safeguard our future. What is health insurance? Quality health care is necessary. It is one of the basic needs of every individual. Health insurance is a safety net that takes care of our financial well-being in case of a medical emergency. It is a contract between us and our health insurance company. When we become ill, we expect to incur medical expenses to recover. By paying a premium, we can transfer some or all of these costs to an insurer who will cover them on our behalf. What are the benefits of health insurance? Better and timely medical care, support medical emergency, financial stability, tax benefits, and peace of mind. Without health insurance, getting sick or injured could mean going bankrupt, going without needed care, or even dying needlessly. Insurance transactions occur because insureds, a person whose interests are protected by an insurance policy, prefer to be risk averse, to prefer outcomes which are more predictable and favorable compared to the risk of suffering a larger loss, which are less predictable and less favorable. They are therefore willing to pay premiums that exceed the expected value of the risk they pose. Buying a health insurance policy is not something that most people are willing to do until it is too late. While the awareness and intent to buy health insurance has increased, it is still not seen as a priority. There is still a big lag between the intent and actual buying. Medical inflation is a growing concern. People are skipping medical care not because they are afraid of doctors, but because of rising costs of health care, which they cannot afford. India's medical inflation in 2021 was the highest amongst the Asian countries. India had the highest medical inflation rate of 14%, followed by China 12%, Indonesia 10%, Vietnam 10%, and the Philippines 9%, and experienced higher medical trend rates than the regional average of 8.8% in 2021. India's healthcare inflation has been rising higher than the rate of overall retail inflation and real estate inflation. For January to March 2023, the average retail inflation was 4.7%. The cost of healthcare in India is rising at an alarming rate. According to a recent report by the National Health Systems Resource Center, the medical inflation rate in India was 14% in 2022. This means that the cost of healthcare is increasing by 14% every year. The expenses associated with such situations could make a big hole in our pocket and affect our long-term savings. Due to these high costs, many individuals are unable to meet their healthcare needs, and it forces patients to resign to their destiny. India ranks high on out-of-pocket expenditure on healthcare. Out-of-pocket expenditures are expenses that individuals pay for medical services or healthcare related costs directly from their own pocket without involving insurance. Household out-of-pocket expenses on health services, especially medicines, continue to push over 55 million people in India into poverty, with over 18% of households incurring catastrophic levels of health expenditures annually, says a WHO report. Despite India being referred as the pharmacy of the world, the population's access to medicines is severely restricted as nearly 65% of all health spending is in the form of out-of-pocket spending by households. Keeping pace with rising healthcare costs. Do we think we are able to cover the cost today? Probably yes. Our work provides a plan that covers us and our family. What about when we retire? And what about 20, 30 or even 40 years after retirement? How much is enough to financially support our family's healthcare needs, ensuring we have a peaceful retirement life? While healthcare is improving, there is also a rise in the number of ailments such as diabetes, hypertension, and cardiovascular diseases. Think we don't need health insurance? Take a look at some of the treatments and how much they cost. Let me just pick liver transplant, the most expensive procedure, at a maximum expense of rupees 32 lakhs today, and show what it would cost a 38-year-old man today after 27 years when he retires at the age of 65 years. The rate of inflation fluctuates, it is never fixed, but let us assume it to be fixed at 14%. Be prepared for it to be way higher than our imagination. It would cost us rupees 11 crores approximately for the same procedure. And for the same person going further into the future, after 52 years, at the age of 90 years, it will cost him or her rupees 291.2 crores for the same liver transplant that costs rupees 32 lakhs today. This is the compounding effect of inflation. Always remember, the two key aspects of financial planning are longevity and inflation. It has never been more imperative to keep ourselves and our family financially secure by buying a health insurance policy well in advance. Reasons for rising costs of healthcare: growing population, increase in chronic diseases, the cost of special medical equipment and advanced technology involved in treatments which are passed on to the patients, scarcity of specialist doctors, surgeons in a particular field, and experts who are qualified to use advanced medical equipment and robotics. As quoted by Jack Ma, buying insurance cannot change your life, but it prevents your lifestyle from being changed. An illness can wipe up an entire family's savings that they have saved for decades by the medical bills. You will not turn bankrupt because of buying insurance, but you will cause your loved ones to turn bankrupt if you don't. And as quoted by Satya Sai Baba, the grace of God is like insurance. It will help you in your time of need without any limit. The insurer and the insured are not two separate entities in this economic condition, but are two faces of the same coin. before I conclude, a serious illness can be traumatic and overshadow other concerns in life. Managing the expenses of treatment adds to the stress, with the fear of depleting lifelong savings. Having adequate health insurance can reduce the impact of rising healthcare costs and provide a sense of security for the future. Considering inflation is important when determining the appropriate coverage. Your health matters. May the force of good, long, and healthy life be with you. Please go through the description for the sources for this presentation. I've shared the link to my next presentation, Unmasking the Lifelong Risks of Investing in Real Estate, at the end of this presentation. And do not forget to check out the playlist for more presentations. If there is something to gain and nothing to lose by asking, by all means ask. Thank you for taking the time to watch this presentation. I sincerely appreciate it. Namaste.